thank you for joining us. I'm Dorothy Dillard. I am at Delaware State University. I'm the core lead of our large, newly established IHER Center. So that stands for the Interdisciplinary Health Equity Research Center. So what we're trying to do in the bigger scheme with that center is to use our resources, our researchers, to advance equity in our health. So we know that across all our health conditions, our Black and brown residents here in Delaware don't fare as well. And we've known that forever. And we're not seeing a whole lot of movement in kind of making that gap smaller between those health outcomes. So our center is very much focused on bringing the research capacity that we have, as well as our community engagement. So I'm in charge of the community engagement core, and what we do in that core is partner with great resources out in the community, like the Delaware Breast Cancer Coalition, to understand better the programs that they're working on to improve health, and to connect our researchers to help our researchers better understand community context, cultural relevance, to help influence their research, and also to learn more about what the community partners are doing and how we can help promote their work and look at its effectiveness and communicate that. So that's what I'm going to do today, is to talk about this great project that we had. It's a little quirky because it's kind of bringing researchers who sometimes are in the labs, right, and don't always think about the specifics of the communities that they're hoping to improve, you know, the lives of those residents, with our community partner, Delaware Breast Cancer Coalition, who's so in the weeds with the community and knows them so well that sometimes they're not aware of kind of the bigger picture. So we want to bring the very people-oriented experts to the lab innovative research experts together, just to learn and grow together. So Delaware Breast Cancer let's see. The Delaware Health Science Alliance has this competition where they ask folks to come together across a lot of different institutions, Delaware State University, University of Delaware, the Christiana Care, Nemours, folks who are doing research to get together and think of projects that they can support, the Delaware Health Science Alliance can support. So it works. It's not. It was an interesting process because it allowed me to work very closely with one of our breast cancer researchers at DSU, who's not with us anymore. He's moved on to a different job, but I was able to find some other researchers, and I'll talk about them in just a minute. And then to work with Dr. Scott Siegel at Christiana Care's Helen Graham Cancer Center, and to work with Heather Bittner-Fagan, who also does work primarily in lung cancer. Dr. Siegel's doing his work also in breast cancer as well. And for us to think about what can we do? And I was like, you know, let's figure out, since everybody's basically looking at breast cancer, that's where a lot of our research at DSU is. Let's see if we can't connect with the Delaware Breast Cancer Coalition. So that was an easy, you know, connection. They were all in. They said, we have this great program. One of the areas that Dr. Siegel and Bittner-Fagan and I'm blanking on his name. Our DSU researcher that we talked about was what's happening in the Haitian Creole community, particularly in Sussex County. So that's a very large community in Sussex County. And we know that we are behind in understanding breast cancer among African American women. But then we start to think about the Haitian community and the fact that on our medical forms, on our census forms, we're not even giving them an opportunity to identify as they see themselves, right? So any of us who come from something other than just plain white American understand how that is, right? So I know I'm not telling you anything new. We also saw some very small, very local projects, one of them in Atlanta, Georgia, where they did do research specific with the Haitian Creole population, and they were able to look at, to be able to get through clinical trials themselves and to look at triple negative breast cancer in general, and they saw some differences. So we were like, this is an opportunity for us to get on to this project. So what do we want to do? We want to better understand the effectiveness of the program that Delaware Breast Cancer Coalition was conducting in the community. So they have, and correct me if I've got these names wrong, but they DBCC has the Chanpyon program, which is created for the Haitian population to bring people from the Haitian community in to teach them about breast cancer, and then to have them go back to their communities to promote with their friends and family and community members in a way that is understandable and comfortable to the culture about breast cancer and the need for, I mean, the ultimate goal is to increase annual mammograms among the Haitian women. Delaware Breast Cancer Coalition has a sister program, Chanpyon, which is for the Hispanic population. So we were like, okay, let's strengthen our relationship, our research practice partner relationship with Delaware Breast Cancer Coalition. Let's bring in our bench or lab scientists who often don't interact with the community, and just build that relationship, and let us bring something to the Delaware Breast Cancer Coalition in the form of doing a small program evaluation of the Chanpyon program to see if it's effective, so that they have a third-party evaluator, if that makes any sense to people, to be able to share the effectiveness of their program. And then we also wanted, so that's the Chanpyon evaluation. We also wanted to make sure that we had a way for our researchers to have direct contact with the Chanpyon community, the Haitian community. So we created what we call research conversations, where our lab researchers at DSU would come and share what's going on in their labs, what they're researching in very regular people terms, lay terms, common people terms, and get practice in thinking about how to communicate research to non-researchers, and that's a really important skill to have, and that's one of the areas that I've worked in for a really long time, is figuring out how to do that. So we've got those two pieces. So I'll talk a little bit about those research conversations. We recruited, as I said, Dr. McNaughton left DSU. He was one of our first researchers. So we found, we recruited two other researchers, both from the biology department. And then we also thought it was a great opportunity to bring BB Healthcare into the fold. BB is the primary healthcare provider for most of Sussex County. Tidal Health is also a big provider down there. But BB had just opened their new breast health center So they're also working, in this space of promoting breast health and promoting early screening and, annual screening. So we wanted to bring them in. The first thing we asked our researchers to do was to do what we call a bio sketch, a short bio. Is just who we are. And we're so used to writing that in really heavy technical researchy language that when I read my good friend Dr. Carl Milletti's research, it makes no sense to me. I'm a sociologist, so it's all these terms, and sometimes like the language they use can take up a whole line to talk about like the cell, and I didn't know I had so many cells, and so it's good practice for them. How do I just communicate? Because the research they're doing is to help just regular people, who don't understand all of that, but can understand what they're doing in the lab if it's presented in a way. And Dr. Milletti jumped on the opportunity. Dr. Perchiniak, who is our other biologist, jumped on that opportunity as well. So we wanted, also one of the other things that happens is so often folks like us who aren't in the lab doing research forget that the people doing the research are people and that they're motivated by some of the same things that bring us to advocacy work or healthcare work or educational work, right? So we also wanted to help them think about how to present themselves as real people. I mean, we don't often talk about why we got into this research, but that's what connects us. That's the humanness of it. And then also the other thing we wanted them to do was to create a presentation that described what they were doing in regular people terms. So I've been doing community engaged research for 40 years. This has got to be one of the most fascinating projects I've ever worked on. We had 3 sessions on different Saturdays at the library. Go libraries, they're amazing in Delaware. At the library in Georgetown, Delaware. And our researchers would come in. We had done flyers so that the folks coming to the meeting who were all the champions and working in the Chanpyon program at DBCC could learn about their research. And so we helped them create these bios about who they are, how they got to do this work, what drives them. And then our third researcher is Dr. Whitmer, Dixon Whitmer from the Delaware BB Health Center. And she and her colleague, Dr. Richards, they do a lot of clinical trials. And so they were interested in doing this too. I didn't plan this. I'm one of those people who kind of throws spaghetti at the wall and sees what sticks. Well, it all stuck on this one. It was pretty, it was dots. And, I was surprised we got funded because, we were like, we're going to do this and we're going to do this and hope we get closer together. But they were intrigued with it. And so I just had such fantastic support and enthusiasm from everybody that worked with us, from the Delaware Breast Cancer Coalition, from the Chanpyons who are Haitian, and many of them didn't speak English. So here we are talking about research that I don't even understand, right, those terms, with folks who don't even understand English. So we had a fantastic translator, incredible translator. So Dr. Perchiniak did the first presentation, and she's she's a general biology scientist, and she studies cells and what about cells make them, as she says, misbehave. So that's, cancer cells are misbehaving. So this just worked out perfectly that she did the first discussion, talked a lot about, P53, which now we have this group of Haitian women who talk about P53, the cell P53 in the community. And that's a cell that has a lot of influence on other cells and what happens. It can be a protector, or when it's not working well, it can kind of fuel other cells acting badly. I hope I said that right. Don't repeat that. Check with Dr. Perchiniak before you repeat that. But that's basically what she shared, and it was a great experience. We walked in, we got ourselves settled. Dr. Perchiniak, jumped on the opportunity. Like I said, she was so willing just to go with it. We didn't really know how it was going to go. The women walked in, they sat down, they all kind of had their heads down. I'm like, oh, this is where it falls apart. So let's see what happens. And Dr. Perchiniak introduced herself, started talking. About 2 slides in, she looked up and somebody had a question. Something had connected, and they asked the question, and the conversation started. They started to understand better, if we've got breast cancer cells, this thing with P53 that may be, connected to this. Lots of questions about who inherits what cells. And so Dr. Perchiniak, God bless her, just went with it, picked out slides that might help, didn't feel a need. Sometimes as teachers, we're like, okay, we got to get through this thing in order. You can't understand that unless you understand all these things first. But you can understand because you ask questions. That was actually the best parenting advice I ever got. Answer your children as simply as possible, and they'll ask more questions as they're ready to understand more complex. So we can bring that to our conversations between the community and researchers. Dr. Perchiniak did this great job, set everybody up. She got them understanding how cells kind of start misbehaving, what might be going on that cause problems that create the cancer cells, right? Dr. Maletti, who's down the hall giving this same presentation in Spanish, came to this work because of a huge family history of cancer and him just wanting to understand it. So sharing that, we have the sympathetic connection. We've all been there, whether it's our own experience or a family member. And his research is very specific. It's in the lab. It's looking at cells and looking specifically at differences between European women, white women, history of European ancestry. So white women versus African American women. And he took pictures and had it in a slide deck of the cells and when he does things to them, how they react. And so the women could see those differences. And he explained the differences. And then he talked about how we don't know, one, we don't have enough African American cells to work with in the lab to be able to have the statistical assurance of the findings and those differences that we could see in his peach tree dishes on his slides, if those are the representative differences or if it's just a difference with these cells. So and then he talked about how we don't have anything from the Haitian community because we might, but we don't know because we don't ask. And the participants, the Chanpyons, were even more animated and more interested in what was going on and how, what does a clinical trial mean? How do you get your cells? And that got into a discussion about clinical trials, which set us up for Dr. Dixon Whitmer to come and talk about clinical trials and the different stages of those. So that's one of those times where I just trusted the process and divine energy, and it came together really well that they were in that order. And here you can see our evaluator, Zachary Bernard, who's a student, he just graduated, but at the time he was a biology student at DSU and also happens to be Haitian Creole. So it connected to him and his, desire to help his community, and to also take what he had learned in biology and understand how to bring it, that community interface and community voice. So this was a great experience for him. But both the researchers and the participants got so much out of it, just to know that the researchers are human beings who also in their own lives have some of the same histories, that they understood the biology part of it better, and that they would come back to these research things even if they weren't compensated. We did compensate them because it is their time and their information, so that's important. And then our researchers just, they hear about community engaged research and they're like, how do I do it? And I said, come with me, I'll show you how you do it. And it may not be directly, it's not, you know, the community doesn't need to be in your lab with you. You need to be in the community, explaining what you're doing in the lab. So a great experience for everybody. And then the other piece of it, and I actually don't have anything telling me the time, so are we still good? Yeah. I just found a little clock up there. So the other piece was the service that those of us at universities should always have an eye toward. We shouldn't just be asking people to be in research. There's a long history of that. Completely understand the mistrust of both the healthcare system and research, because too many years of mistreating and actually hurting particularly minority communities. So that includes African American, Haitian, our criminal justice folks who have been used in really unethical research, and we need to keep that at the forefront. So I think that's the other thing that helped, was that, you know, we have much better ways of doing research and have those ethical things. But even with our work with building the community relationships and community engagement, it's important. DBCC's out there working hard. Every nonprofit, every advocacy, education, health, you know, group, the libraries even, right? Really having to fight and spend a lot of time and energy for money, and to get that if you can show that what you're doing is effective. So that's something that we as researchers should be doing, is thinking about what the community partner can get out of the work that we do. What kind of deliverable can we give to them? So Zachary Bernard worked independently, which was great for him because he's transitioning out of, you know, internships and supervision and being in college to going out into the community. So being able to do the independent work, I and Dr. Perchiniak worked with him, you know, just to give him guidance, and he'd come and ask questions. But he put together the evaluation, and he had a quantitative part and a qualitative part. So the quantitative part was to look at the records that DBCC had and ask a few key questions and look at the effectiveness of the program, primarily on increasing annual mammograms. And then the qualitative piece was to talk with the champions and some of the people who had been in the program about what they had gotten out of it. And then we also snuck in some questions about what they thought about the research conversations that we had. So these are just, and I'm going to provide these to DBCC. The CED core that I'm in charge of at DSU, we have a spotlight, a health information spotlight that we keep up, different topics that we keep up for about 3 months. But that we'll have this information there as well. We're going to focus, October, we'll switch over and focus on breast cancer. So we'll have this project and our researchers and other information in DBCC. So we have, we spotlight our researchers in the health area as well as our partners. So we'll also have this information posted there. So I'm not going to spend a whole lot of time going into it, but the one thing I do want to point out down here at the bottom, the third one from the bottom, is that only 30%, about 30% had of the participants in the Delaware Breast Cancer Coalition program had a mammogram in the past year. So when you see the age, the average age was 57, that's above 40. You know, we're thinking, because 40 is where we start doing our annual breast exams, mammograms. I'm going to walk right through this very quickly. This is just the different cities where, just to give DBCC an idea of their coverage across Sussex County. And then we also looked at insurance type. And this is something that's coming up in a number of health topics, disease condition issues, is that about 98% of Delawareans have some type of health insurance. the issue is not having the health insurance. It's knowing what it covers, making sure that the copays are affordable, and making sure that we have the medical coverage, right? So you may have health insurance, but if you can't get into a doctor, or you have to give up a day at work because you have to go see a specialist who's 2 or 3 hours away. Wilmington's a little bit different, concentrated more here, but for those of us in Sussex, that's a whole day, right? So that's one of the things we're looking at in some of our other work. But what we do see is for those few who don't have health insurance, that there's a greater percentage who are not up to date with their mammogram. So health insurance and those provisions are really important. Those benefits are really important, coupled with the education of what you should be getting done, right? This is looking at the 2 different areas, which I'm going to kind of skip over also. But as we can see, it's clear that as we get older, we get better with our doing our mammograms. So that's the darker blue, up to date with mammograms. And then not up to date is the lighter blue. And as we get older, we get better because that education, we've consumed it, right? We understand it, we know it now. One of the things that we learned is that there were several people who had experiences with family members who were diagnosed with breast cancer younger than 40. And so they wanted to go, they were about the same age as their sister, one example, and they wanted to go to have a mammogram, but because they were under 40, there was a lot of resistance and they had to advocate for themselves. So now we also, often with our immigrant populations new to the U.S., just even finding, the Haitian Creole community has such difficulty even finding anybody who close to speaks the language, and then needing somebody to go with them, and the translation with what you can get like in the doctor's office on the phone doesn't match up very well. So they're just basic problems with that to begin with. But then you're finding out this really shocking, disturbing information. You've got all the emotions you're trying to work with, and then you're trying to understand the medical piece of it. So we learned a lot about those things that we can also help improve with communication. So, and then we also see that one of the impacts of the Chanpyon and Chanpyon programs is that once you're out there longer, the information begins to ripple out. And so over time, when we look at it, we see that those who have been referred more recently already kind of are primed for that information and are ready to act on it. So overall, we saw notable effectiveness in increasing annual mammograms, of getting the program out there, of getting information out there. The biggest barriers for those who don't have health insurance, that was the barrier, even for those who did, understanding how to navigate and to advocate for yourself. That's hard work. I'm 61, I've had 3 kids, I've been advocating for myself and people for a long time, and it's still hard, I don't have the barrier just from what I look like with most doctors, white privilege, that's assumed from that side, and lots of education. It's still difficult. So that's on that end of the medical and how to make that bedside manner. And I know that that's also driven by health insurance, right? They've got 10, 15 minutes with you, and you're gone. They've got that pressure. And so thinking about other ways to do that. So I think I'm walking through some of these, but I've shared some of this. just this is the qualitative lived experience piece about what folks got and how important it is to have someone to help you navigate and to give you the information that you need before you go in. So from the interviews, certainly fear and anxiety, sometimes, you know, we think ignorance is bliss, and that just doesn't work out so well with health conditions, right? The sooner we know, the earlier we know, the better the outcomes. So still working on trying to address that fear and anxiety. And again, the importance of having somebody who understands your community, understands your culture, can speak your language, you know, to help you through is so critically important. And that's what the Delaware Breast Cancer program has demonstrated. So I think I kind of went over the success factors. I think that's just a repeat. So, and then just a few things that we saw. This was an interesting conversation when we presented this within the group, but increasing the support and ability, you know, more people helping out and navigating, but also, and this was interesting coming from Zachary, who's a male, who's like, I heard a lot of complaints about having a mammogram and how painful. Can't we fix that? And so Dr. Dixon Whitmer explained why not in a lot of detail. But I think that that's, you know, an interesting piece is that we understand better why we have to go through whatever, you know, exam that we have to go through. So, and then we do have a report. Like I said, we'll be putting this on our website soon, next month, and so that's you can just. I don't have cards. I should, but. My name is Dorothy Dillard. I think I actually, yep. So it's ddillard@desu.edu. So, you know, if you have more questions or are interested in things or want to have the link to the website, let me know. Any questions? A lot of information there, but I hope you got something out of it. It's, yeah. So, any questions or? Nope. Good. All right. Well, I thank you for your attention. You know, it's that social work teacher mantra. If I can get to one, I might get to two more, and just, you know, spread the word. And kudos to this great program that DBCC is doing. I hope you know a little bit more about what DSU is trying to do in this space, and really, you know, focusing on that equity, all those equity issues. So, all right, that's it. Thank you. Thank you.